This is the table of daily magnesium requirements, which here begins to answer the question that was asked online. It is roughly between 300 and 400 milligrams per day. This is in America. It varies a bit depending on age. In children, it is much lower if you are pregnant, more if you are breastfeeding, but roughly, give or take, between 300 and 400 milligrams per day. Be careful. You always have to make sure that kidney function is good. It is my main concern with magnesium supplementation, that kidney function is normal. If you have a patient on dialysis, if you have a patient with renal insufficiency, you have to be careful because hypermagnesemia also exists, which is not advisable at all. It is not due to a lack of availability that this is not known. I really think it is that we have paid little attention to it. This slide is a screenshot of a page from the American government where everything we are seeing this morning is explained. It is online, free access, the introduction, what magnesium is, an abundant mineral in the body, etc. And here it is, the entire index. So the information is there, the evidence is there, both at the level of scientific journals and at the public level. That's why it's easy for us to really launch a campaign, because there are many tools we can rely on. In Europe, the citrate range is broader, from 150 to 500 milligrams per day for adults. These are the sources, we already know that. The nutritional sources of magnesium, mainly dark chocolate, thank you. Organic is the one that has the most magnesium per milligram. The types of magnesium that exist: to boredom, carbonate, chloride, citrate, fumarate, gluconate, glycinate, lactate, oxide, aspartate, salicylate. What I get the most, what I find easiest, and what people tolerate best is citrate. Citrate, which as you can see has good availability. They say that lactate is the one with excellent bioavailability, magnesium lactate. It's not necessary to know too much, and I am a fan of individualization. Some people cannot tolerate citrate because they take a pill and the next day they have diarrhea, so we change it. Bioresonance techniques for diagnosis, techniques of individualization, that the patient tells you this doesn't sit well with me, even if you don't understand why, listen to the patient and change it for another. I believe that raising magnesium levels is very easy nowadays, with nutrition and supplements. Since there is so much problem with poor absorption today, it is good to turn to supplements. You also have to let the body rest from time to time. Supplement for 3 months, 6 months, then rest for a couple. To vary a bit, not to be fixed with medicine, because your body every 6 months is a different body. The body that is here speaking has nothing to do with the one that gave the first lecture of the masters. I have different platelets, my ocular cells are different. What I had for breakfast this morning is different from what I had that day. So the one speaking here is possibly the same spirit, but the body has nothing to do with it. It is interesting for the stomach to be empty. Some people cannot tolerate pills on an empty stomach, but it would be ideal to facilitate their absorption. It competes if administered with other vitamins and minerals. It is good to tell people, hey, if you take your supplements, set magnesium aside and take it at another time. I usually recommend it at night. When I'm going to give 400 milligrams, I divide 200 in the morning and 200 at night. But if I'm only going to give one pill, one dose a day, I tell them to take it at night because it may have some effect that helps with relaxation at night. And there are many presentations of all kinds. There are tablets, capsules, powder, solution, in salts, in patches, in spray, in oil. There are many, each with its pros and cons. To finish talking about magnesium, talk in detail about the 4 main causes of excess magnesium and what should be carefully considered before supplementing. When there is an increase in cell destruction or accelerated mobilization of potassium into the cells, and note that exercise can be a cause of cell destruction. Caution should be taken when there are high-performance athletes or people who push themselves hard in the gym. This leads to, for example, enzymes like CPK, which is muscle-related, rising, usually elevating the day after a training session. If they are also taking supplements to get fit that strain the kidneys, caution is needed, and even if it seems very healthy, try to give doses, healthy for the patient, without exceeding magnesium supplementation. This should be taken into account. When potassium is not properly eliminated by the body, basically because there is a kidney problem, and you may be consuming too much magnesium in your diet. If you take 3 tablets of dark chocolate a day, then you are getting magnesium in abundance, so there is no need to supplement. And before, I think this is becoming a bit trendy, antacids, some contain magnesium, and there were also additional sources there. Questions, comments, doubts, as we are going to change Musketeer? Well, for blood pressure, for heart rate, for heart failure, for diabetes, for metabolic syndrome, they just need to say that it's also good for calluses, and it would be just like aspirin.
You mentioned that conventional methods for detecting magnesium levels are not the most suitable. Could you comment on which ones would actually measure it accurately?
The hair test is a cheap test, but it is still very controversial. Erythrocyte magnesium, and I confess I am a fan of bioresonance. Talking about bioresonance is a very broad field, but there is method that is starting to gain prominence, an individual diagnostic method, which is the ability to assess the magnesium content you have in your body at that moment. But what Alejandra says is the main one, although I think it is not very cost effective. That is to say, it doesn't make sense. It is much easier to start supplementation and do a trial response test than to go through more tests with more things, and insurance companies, for example, do not cover this or cover it under specific conditions, and in the end, it puts the patient in a mess that is really unnecessary. What is good to know is that normal circulating magnesium does not rule out hypomagnesemia in the cell.
Thank you. Good morning. I wanted to know if in allopathic medicine, there is any medication that has any contraindication for giving magnesium. In relation to calcium agonists, as it is an antagonist of magnesium, if you have high blood pressure, is the cardiologist giving you any? Well, if it exists, it's because I am very blocked. As always, I start very blocked.
Any antagonist of magnesium?
No. Contraindication. With magnesium in allopathic medicine, antihypertensives, for example.
For example, the diuretic causes you to lose magnesium through urine. The calcium antagonist already makes it so that if you add magnesium, you could induce hypotension. So you can enhance, with magnesium, you can enhance the effects of the antihypertensives that belong to the same group, that is the calcium antagonists. And yes, we could because there are many medications. Statins can also have an effect through vitamin K2, affecting the metabolism of calcium and magnesium involved in some way. So fundamentally, yes, there are, but more on the side of drugs that cause magnesium loss, like diuretics, or drugs that are enhanced by the use of magnesium, like calcium antagonists.
That's what I was referring to. If there is a specific one that you can tell us that is usually prescribed, to be more cautious.
There is no risk in adding magnesium to other antihypertensives. You can even later, depending on the patient's progress, withdraw the other antihypertensives.
Indeed, and the same goes for anti-diabetics. When you start supplementing at any level and the patient is taking allopathic medicine for something, there comes a time when the body starts to stop manifesting the symptom. If you are increasing magnesium levels, it is logical that the hypertension will start to disappear. So the enalapril and amlodipine that were taken in the morning, eventually the patient will come back in 3 months saying, hey, I feel dizzy at noon and I check my blood pressure and it's 90 systolic. So what needs to be done is not to stop the magnesium, but to start lowering the antihypertensive.
A very simple question. For these people with cardiovascular problems, hypertension, or arrhythmias, to whom we recommend magnesium, would it be advisable to recommend a magnesium supplement alone? or magnesium with vitamin B? Since many supplements already add vitamin B, I don't know if it is preferable to have just magnesium.
There are patients, not diseases. That is a principle we are trying to reclaim. Therefore, there will be some who do. For example, if their illness is related to alcohol consumption, you know that alcohol is one of the main depleters of the B group, of B group vitamins, so maybe it would be good for that person to have magnesium with their added B complex. But there may be others who do not need it, and it might be better to take coenzyme Q10 and omega-3, because unfortunately, the economic factor is still important in this matter, and supplements are very expensive. People who are just starting to open their minds to this world say, but let's see, if I go to my general practitioner, they will give me 3 pills that cost €3 at the pharmacy because that is subsidized, and you tell me to take magnesium, which will cost me €20, €30, plus coenzyme Q10, which doesn't go below 50, and a third oil, and that adds up to €100 every month. So in that regard, one must have a lot of common sense and choose effectively.